one of the things that we are saying, which is so important, right? That is, here we knew already that there were mental illness issues, that there are stressors that are already there. And as you indicated, we've seen an increase of depression and anxiety by 20 to 25%. In the midst of dealing with the increase of all of that, which is impacting people at all ages, right, families and so on, we also have a lot of mental health professionals to also address all of those issues as well, right? This is why the COVID-19 mental health awareness group that all of you are watching right now is so important, because I can tell you, when I became a psychologist, it was 30 years ago, right? I did not know another Haitian psychologist at that time, right? But that we're making progress over the years, that we have a little bit more psychologists now, so much so we have a Rebati team, we have a Haitian Psychological Association in the country as well as, here as well. But it still means that this idea of coming to get a mental health degree is not something people are looking to do, right? And I can tell you, because in my department, I head a unit at UM, we have a marriage and family therapy program, we have a licensed mental health program, and I can't seem to get our black and brown folks to come and get this degree, right? And I can even offer scholarship, and I still can't get people to come and do it. But we need that for everything you just mentioned, that when somebody shows up in a space and they see somebody that looks like them, they know somebody who can speak the same way that they speak, it matters in terms of that. So representation matters, in terms of the profession. And so we really are encouraging to this forum, to this process, so people can understand that coming to get a degree like Majorie did, right? I'm waiting for you, okay, for that degree, for you to come and get that degree, right? It's really, really important, because the community needs it, right? The community needs it, and so forth. And so with that, I know we're going to talk about wellness, right? It's a good segue, right, to talk a little bit, because we've been at you with all of the things that is wrong, all the issues and so forth, right? So this is a good pivot point to say,
yes, what do we do to cope?
Yes.
Wellness point. I know it, Nzingah, the queen, it's awareness is going to start with us. What can we tell our viewers and what they can do for their mental health wellness?
Unplug.
unplug.
No, seriously.
Not right now, though. She didn't mean now.
But seriously, I think that's a big thing that we take for granted. Sometimes we think it has to be something grandiose. And social media media in itself has really impacted our mental health as a people. So one of the things I knew I did years ago, and I encourage people to do on the front end, was look at news at your terms. Don't let news come to you without your permission to derail your day. And then unfollow accounts that throw media in front of you that you don't want to see, and take some time offline. And make sure you're following accounts that align with where you want to be and the place that you want to hold fast. Because a lot of times we follow accounts that are not in alignment, and we're skipping through our day, and we turn on our social media, bam, it's over. And don't watch images of black and brown people being killed. You know the outcome. Why are you vicariously traumatizing yourself? And so media has caused a lot of what we call vicarious trauma, and unplugging is such a big thing for me. And not watching what I call trauma porn, or what we call trauma porn, because it does nothing for our mental wellness.
And you don't just mean like social, you also mean like WhatsApp.
Yes.
You know how you guys get a message,
yes,
you get a video, and then you see it. You didn't actually see the whole video, and you press forward, right? And the person is like in the middle of work or in the middle of school, and they open it up and they didn't even know what they were about to get, right? And so forth. So we're really, really unplugging. Unplug, that means good.
Yes, I do agree with unplugging, because social media, like, it tends to have this mental effect on youth also, but also not just unplugging, but getting in tune with yourself, finding out the things that are making you sad, finding out the things that make you feel good, doing the things that even if it's a hobby like me, like whenever I feel some type of way or I'm feeling down, I go play basketball or I listen to music or I write poetry. Doing things that you like to do so that you can actually get in tune with yourself. And like we know more about other people than we actually know about ourselves. So get to know yourself.
Say that again. Go ahead. Drop that again. For those who are way in the back.
We know more about other people than we actually know about ourselves. So get to know yourself.
Get to know yourself. Okay, now.
Jonathan's gonna go.
I would say everything in moderation. Although social media can induce a lot of anxiety and stress, it is also beneficial. You have YouTube videos now of psychologists, clinical psychologists telling you about symptomatology of disease and disorders and things that you can do just like to increase your wellness. And so everything is in moderation. One of the most important things is to take time out for yourself to get to know who you are, the things that make you, like you said, happy, and some things that make you sad, or toxic people. Some people make you feel joyous, other people tend to bring you down. And so having those barriers for yourself to protect yourself, because it is all about you. And it is not a one-way approach. It's whatever you feel that you need to do in the moment to take care of you, then that's what you do. So that's what I'm saying.
Very important. Especially in our Black community when we think that self-care is selfish. So we're here to tell you that self-care is not selfish because you have to pour into you in order to pour into others. So if you don't take care of yourself, you cannot take care of others. So what can you add for self-care?
Not too much. It's difficult sometimes because you get bombarded by information that's coming from everywhere. There's no way we can manage information that's coming to us. But what we can manage is how we process that information and determine to a great degree the outcome of it. One thing that I wanted to talk about, though, and this is personal, many years ago, as a young teenager and young adult, I used to play soccer, basketball, and other sports. Tennis was one of my favorite sports. But lately, I started walking. Not because I wanted to, but because my doctor told me, you have to walk. And I cannot tell you how much it has done for me. Walking 2 miles at least 3 or 4 times a week. Wonders. There's quite a few things that we can do. Exercise is one of them. But eventually, some of those things do not work, which by the way, many will work. Therapy is always available.
Yeah.
Always available. We talk about thought processes, how we can change our thoughts. Disputing negative thoughts, absolutely, yes. Well, he knows that better than I do, so maybe you can talk a little bit more about that. So there's quite a few things that we can do. We had yoga earlier, meditation, we talked about exercise, dancing,
Cooking.
Those of you that like compa, gardening.
Wake up during COVID.
We don't have to do too much. A little bit at a time goes a long way.
Yeah, get your compa, right?
Yes,
Spending
compa.
time outside on the sun. If you are like, the work is driving you crazy, schools, you just step outside for a couple minutes and that absolutely will do it. We have an excellent process that we talk a little bit about. It's a framework, we speak a little bit down to what you were saying, called SEL, S-E-L, SEL. And it stands for sit with yourself, get to know yourself, understand yourself, sit with the feelings a little bit. And then E is for express it, right? There's some things that are coming up. How do you share it, right? And expressing it could be, I'm going to write about it. I'm going to write a song about it. I'm going to do poetry about it. There's so many ways that you can dance it. There's so many ways that you can do the expressing. And then the L is for leaning in. You have to lean in and let go of these things. And as you were saying, Brother Jonathan, before, that you have to recognize that that experience is not you. Right? It's an experience that you have it, but it's not a part of your identity. So much things that one can do. The other thing I want to say very quickly that we know, and research is really, really clear on that, which is why we're talking about the wellness piece, and that is, for every single one negative thought that sits in your mind, you need 17 positive ones to get rid of that one. You hear me? So for everyone that allows itself, so when I say, well, no, I'm no good, or I'm not good at this, I need 17 other thoughts to get rid of that one. So the more I'm doing these kinds of activities and working on wellness, then the less of these negative thoughts sip through the mind, right? In the same way. The last thing I'll say is actually I'll say two things. One is about the importance of gratitude. Let's really write, because gratitude has been shown to be a significant part, and you should practice that twice a day. You get up in the morning, because I sometimes meet somebody at 9 o'clock and I say, how is it going? They said it's an awful day. It's 9 a.m. The day hasn't really started yet. You can't have a bad day yet, right? And so if we start the day with what are some of the good things there, 3 things that you need, 3 things in the morning, repeat that again before you go to bed. 3 things that you're grateful for the day, right? But here's the key. We're talking about all these things that you can do around your wellness path, right? And so on. But we also know anything you do requires you to develop a habit. And here's the research. That if in fact you want something, like brother's doing here, walking, and you want that to become a habit, you have to do it for 21 days straight. Not 19, not 18, not 17, 21 days straight, right? So if you actually stop in days 19, you have to go back to 1, right? Over. So it really is important that we take the time to really, do some of these things and practice them. And let's practice a little bit self-compassion, right? We're going to forgive ourselves. We're going to be good to ourselves. If you didn't get a chance to walk today, you're going to be like, it's okay. I forgive myself. I'm going to pick it up tomorrow, right? So that we're not hard on ourselves, because as Brother Davis said, we are the hardest, right? We don't know ourselves that much. And so we're really asking all of you to take the time, right? Take the time, be good to yourself, forgive yourself, right? And provide a level of self-compassion. The same way I'm being compassionate to you, Majorie, I'm going to practice a little bit of that, give myself a little bit of dose of that myself, right?
Yes, I agree. And I'm about to wrap it up, but we know that nutrition plays an important part on our health. So Nzingah, can you tell us if there's certain food that impact our mental health or not?
Go ahead, girl. Go ahead. You talk about the cravings, girl. Because okay, please go.
We're not talking about EO, are we?
No.
So research shows that certain foods can have a positive or negative impact on our health. And certain food, if you feel good, you'll feel good mentally, and when you don't feel good, you won't feel good mentally. Those 2 things are usually tied together. And oftentimes, we have feelings that are lying below the surface that we don't understand. We don't recognize what's going on because we're so busy adulting. And so in holistic medicine, we look at cravings as indicators of some things that might be going in terms of nutrition, but we also look at cravings from a space of what's going on emotionally. And so your great cravings can tell you things that are going on emotionally, such as sugar. Sugar, this craving is an indicator that you're either giving out too much love or not receiving enough love. They're one and the same. And sometimes the sugar craving is hard because it's not necessarily the love that you have in real time. It might be parental love that you never got as a child, and you're trying to compensate through these sweet foods. I'm saying that. Salty craving, chips, salt and vinegar chips. That is usually an indicator of saltiness. Like you're salty about, that phrase, oh, she's salty about something. Frustration around something. Anger. Tension is related to crunchy foods. Creamy foods like ice cream tells us that you aren't receiving enough nurturing, that you need to be nurtured more in some type of space in your life. So sometimes our cravings, and craving is not, oh, I like this food. All of a sudden this thing comes up like you're a pregnant woman, I need to have this now, right? And we're not monolithic with our emotions, so oftentimes we will have one thing that will have all our cravings in one place. The chocolate caramel toasted ice cream with nuts on top, crunchy, creamy, salty, and sweet all together. And I'm not giving this information to beat you up, but sometimes, a lot of times, our body subconsciously or consciously is telling us, hey, pause, stop, become more aware so that you can accommodate your needs and figure out what's going on with you. So when I say unplug, part of what I mean by saying unplug is take some time in your day, every day, just to stop and check in.
And recognizing the food you eat, the message that you're saying here is that the food you're eating, right, which oftentimes sometimes we eat just to eat, right, but that in of itself, right, so if I put a burger versus if I did half a burger and a salad into my body, it matters in terms of my emotional state, right, which is what you're saying, which is really, really cool. My goodness, is the time really over? Really, we really reached the time? Wow, okay, Yvette. Yes, my goodness. Wow, wow. Okay, Yvette says our time is up, right? Yes, we do.
Well, I'm not too good with social media, I can tell you. So social media does not bother me as much as other people. We're located at 4069 Northwest 36th Street. As I said before, we have been in service in the community for 50 years. And my name is Gene Everard, I'm the director of the homeless department. We provide wraparound services, mental health, therapy, psychosocial services, medication management, wellness. We provide services to families, to children. So we have a big array of services. So my phone number, by the way, sorry, 786-433-8613. That's my direct number. The number to the agency is 305-635-0366. If you feel that you can benefit from those services, give us a call. We're there. Thank you.
Thank you.
Like I said before, I'm with Power Youth Center for Social Change, and for Instagram on social media, you can find us at PowerU305, and our website. If you want to learn a little bit more about what we do and what our goals are, you could search it up on Google, PowerU.org, and we're actually based not too far from here. It's 720. The address is 720 Northwest 55th Street.
Alrighty, you can find us on Affirming Youth Foundation, 150 Northwest 79th Street. We have a lot of services for strengthening families, parents and children. And our social media is Affirming Youth on Instagram, Facebook, Affirming Youth Foundation.
I am at Yes Baby I Like It Raw. That's yesbabyilikeItraw.com. And Yes Baby I Like It Raw on Instagram as well. And what we do is we help you have sustainable practices when it comes to your wellness. Specifically for women, we have a network called Black Women Wellness Network. Myself and Dr. G, as well as Michelle, we have monthly workshops and retreats quarterly where we help you and support you in becoming the best version of yourself from the inside out.
Excellent, right? Well, I'll go Majorie Lozama, and I'm at Empower You. It's at 7900 Northwest 27th Avenue, and the phone number is 786-318-2337. We serve 18 and older adults. And I'm the psych nurse practitioner there, and then we have therapists, we have substance use disorder groups that meet Monday to Thursday from 10 to 12. And any other kind of services we offer. You don't have to have insurance to come to us. We serve you, and we're here to support you.
Thank you so much. So it's clear. So Guerda Nicolas, I'm a professor at the University of Miami, but also we are co-founder of Liberté Santé Mentale, which is the organization that is really focusing on Haitian mental health, both here in the States as well as in IT as well. You can find us on social media and all. I'm also here as president of IT Community Trust, and right after this, we are hosting Boyo here, the film, to really sort of understanding a little bit about IT. This is an excellent film created by Samuel Damius, some of you may know. The reason why film is important because it's a vehicle for being connected, right, to one's history, to oneself in a significant way. And this film brings you back. This documentary brings you back to IT in such a significant way. So we hope that everybody will be here to also watch that as well. So clearly, so we're here not only the opportunity to say, understanding the issues and understanding the symptoms and being educated about this is so important, But also there are resources, right? There are resources that are indeed in the community that we can reach out to, right? And so we encourage you to continue to follow COVID-19, right? We're Mental Health Wellness Group, but shout out to all of the amazing work that they are doing in the community because they are bringing us in, right, in such a significant way. So thank you for that. And thank you to each and every single one of you for being here with us this evening. Thank you for sharing, right, for pouring out to everyone. We hope that you're going to take some time for yourself, for your own self-care as well. And thank you to all of you for watching with us this evening. Thank you for being here. Thank you. Thank you.
Closing remarks by, first of all, thank you to the panel. Amazing. Let's give them another hand. Round of applause. Thank you very much.
Yes, thank you to the panel. Your information was very enriching. I thought that, the audience will definitely take away from this a lot of information and have some tools to use for self-care. So I thank you for doing that. It's very important that we make sure that we have that information about self-care. Listen, what we have here today is the first of a series of these meetings that we're going to be having throughout the county. And we're going to be having them in various communities. We started in the Haitian community today because this is Haitian Heritage Month. It's also Mental Health Awareness Month, but we'll be in other communities as well. We want to make sure that you go to our website, mymentalhealthmiami.com, and for you to visit the website, take our survey. The survey is very important because the survey will give you a score of where you fall on depression, anxiety, and stress. And it will also give you resources, plenty of resources that you can use. As you heard the doctor say today, there's so many resources that we are underutilizing. And there's so many more opportunities if you have an interest in being in the mental health profession. As you heard today, Dr. Nicolas said that she has opportunities for folks who have an interest. I hope you take her up on that. I hope you take her up on that, so you make sure that they connect with that today. So listen, I just want to say to you all, I know this is not a topic that folks gravitate to, but it's a much needed topic, something that we need to discuss, something that we need to address on a more frequent basis. We have a lot going on in our community. We have a lot going on in our community. When you think about the deaths of loved ones, when you think about the violence with the youth, all of these things play a part on folks and their mental stability. When you think about families who are having issues, wherever there's stressors, wherever there's strains, right now the housing issues that we're dealing with, where folks are being forced out of their homes, these stressors. So this is why it's important, and this is why we're so touched and moved to continue to move this issue forward through the COVID-19 Mental Health and Wellness Program. So we want to make sure that you keep in touch with us. Make sure you go to our website, mymentalhealthmiami.com. Make sure you get the resources. If you want to know anything about any of these illustrious panelists and the moderators, you can reach out to us by going to our website, mymentalhealthmiami.com, and we'll make sure we'll put you in touch with them so that if you have any other questions that you'd like to ask of them as well. Be on the lookout. All of our collateral material is in English, Spanish, and Creole. We are very culturally and linguistically sensitive to the community that we live in. We want to make sure that everyone has the right to understand, well, everyone understands the information that we're providing, and everyone has access. Access is key. Access is key to the services that we are providing and that we're going to be guiding people to. Want to shout out to our partner, our mental health partner, New Horizons. New Horizons is going to be very key and essential to this project. New Horizons will be the care coordination team that will connect folks to services if they were to need services, okay? And the county is also a very key partner in this project. So we want to make sure that you know we will have resources from the county in terms of those of you who may need to be connected with certain mental health providers or that sort of thing. So this is something that we want to make sure that we provide for you. Very briefly, if someone has a question or two, we'll give you a chance because we haven't heard from you in the audience. Does anyone have any questions? No? All right. We want to thank you all for coming out. Let's give the panel a round of applause. Make sure we go over to Dr. Nicholas's movie so that we can see that. You can partake in the food. I have some pizza and some refreshments for those of you who would like to have some refreshments. You just go to see the gentleman in the back there and you can indulge in some of the refreshments. Not the other side, but on this side where the pizza is. Okay, just want to make sure we're clear about that. Thank you all for coming out. My name is Ruben Roberts. I am the CEO of RER Consulting and one of the founders of the COVID Mental Health and Wellness Program. And we hope that you stay in touch with us and we look forward to working with you in the future. Thank you all. Have a good evening.